Can a pathology report determine indolent lymphoma? Have you ever wondered how doctors figure out if a lymphoma is indolent or aggressive? A pathology report plays a crucial role in this process. Yes, a pathology report can determine indolent lymphoma, but it requires a thorough approach. This includes obtaining adequate tissue samples, performing detailed examinations, and using specific tests to identify the lymphoma type. Indolent lymphomas are generally characterized by small lymphocytes that grow slowly. To accurately diagnose them, larger biopsy samples are often needed. This could mean taking a whole lymph node or a larger wedge biopsy. These larger samples help preserve the tissue structure, which is essential for proper evaluation. The pathology process starts with examining the tissue under a microscope. Pathologists look at the tissue morphology, which means they analyze the shape and structure of the cells. They also use immunohistochemical staining. This technique helps identify specific markers that are unique to different lymphoma subtypes. By using these markers, doctors can distinguish indolent lymphomas from aggressive ones and even from benign conditions. While most lymphoma cases can be diagnosed accurately through these methods, there are instances where additional molecular genetic testing may be needed. This is true for less than 10% of cases. The pathology report combines all these findings to classify the lymphoma according to established systems, such as the World Health Organization lymphoma classification. This classification helps differentiate between indolent and aggressive forms of lymphoma. In practical terms, the pathology report provides vital information. It reveals the type of lymphoma cells present, such as the small lymphocytes typical of indolent lymphoma. It also describes the tissue architecture and how the lymph node is involved. Furthermore, it lists the immunophenotypic markers that define the lymphoma subtype and any molecular or genetic features if additional tests were performed. This detailed assessment is crucial for guiding treatment decisions. Indolent lymphomas usually have a slower progression and requiring different management compared to aggressive lymphomas. In summary, a pathology report can effectively determine the presence of indolent lymphoma. It does this by combining tissue morphology, immunohistochemistry, and sometimes molecular studies, as long as the biopsy is adequate and the diagnostic process follows current standards. This comprehensive approach ensures an accurate diagnosis that aligns with clinical and laboratory findings.